Alberta has broken the 1,000 case mark with the addition of 107 cases, and 5 more people have died from COVID-19, bringing the total death count in Alberta to 18. Of those 5 new deaths, 4 took place in one location, the Mackenzie Town Continuing Care Centre in Calgary, where 8 people have died so far. Turning to Saskatchewan now, it has a total of 220 cases. 14 of those are new. And with those numbers expected to surge in the coming weeks, healthcare workers are now demanding the Saskatchewan Health Authority stop being so secretive about its plans and its stock of supplies. They say the lack of transparency is causing them stress, and that a rationing of personal protective equipment, such as masks and gowns, is putting their health at risk. The I-Team's Jeff Leo has been looking into it.
So right now in North America, there is a shortage of personal protective equipment for healthcare workers. That is things like masks, face shields, gowns, that sort of thing. There's a shortage right across North America. And so at a press conference here in Saskatchewan a few days ago, a reporter asked the Saskatchewan Health Authority, is the health authority rationing this sort of equipment here in the province?
The answer to that is no, we're not. We're taking a lot of steps to make sure we understand what is the best use of our personal protective equipment, where is it most appropriately stocked, and how do we ensure that we continue to have the right amount of equipment to ensure our staff are safe.
Now, the leaders of healthcare unions in this province tell quite a different story. They say that their members are being provided a very limited amount of personal protective equipment, and as a result, they don't feel safe. One leader told me that ER nurses are being issued just 2 masks per shift, which the union says is not enough and in fact does qualify as rationing. In addition, the SEIU West, which represents a wide range of healthcare workers, says the government is being secretive about how much protective equipment the province actually has.
By not sharing as much information as possible, I think it's disrespectful to the population, but I also think when you hide information or you're not as forthcoming with it, people tend to get suspicious and they don't trust you.
Now, yesterday at a news conference, the Premier announced some new transparency measures. He says he has directed the Saskatchewan Health Authority to talk to the province about what its modeling shows about how this virus might spread throughout the province and how that might affect Saskatchewan's healthcare system and its ability to respond. It is not clear if the province will be also revealing the supply of personal protective equipment, as the unions have been requesting. Jeff Leo, CBC News, Regina.
Staying in Saskatchewan, we're joined now by Christy Kleimenhege, who's filling in for Sam McKeag again tonight. And Christy, until today, your province had not had a case of COVID-19 in a care home, but that's changed.
Yes, it certainly has. Today, the government announced that an employee at a care facility in Regina has tested positive for COVID-19. We're told that person was in contact with 3 coworkers and 1 resident. Now, they're all self-isolating and their health is being monitored. The resident is also being kept away from others and their family has been notified. The facility has not been named, but it is run by Eden Care, and its CEO says a response plan has been activated and the home is on a strict lockdown with no one being allowed to visit. Premier Scott Moe also announced today that new measures are being put into place to try to avoid any more spreading. Workers will now be required to have their temperatures taken before starting a shift.
We are seeing here today is where we have a positive ID of one of the staff members. And so there are some steps that are being taken today with the government-run facilities, the temperature checks in their facilities to try to identify if there is the potential of a COVID-19 case as early as possible in one of these facilities.
Now, Mo says often people can come to work before realizing they're not feeling well, so taking temperatures at the beginning of a person's shift is an additional measure that will help, along with all the usual physical distancing and self-monitoring protocols.
And Christy, obviously it can be tough to have a family member in a care home without visits, but I hear a lot of folks are adapting.
They are, and while some homes are continuing with art and home gyms, many residents are actually turning to technology. In Saskatoon, the Sherbrooke Community Centre is teaching its residents to use video chat apps like Skype to make sure they're still seeing their families' faces, even if they can't be there in person.
We've gone out and purchased some more iPads and some more some equipment that will kind of like Wi-Fi hotspots, because we were just finding that our Wi-Fi in the building was being pushed to its limit. So we've really adapted, and I'm so proud of our staff for how they've adapted to to technology.
Now, Anderson says staff and residents are adapting to the new normal, and he adds care home staff are really going above and beyond to keep residents happy and comfortable.
Christy Clement-Haga in Regina tonight. Thank you, Christy. To the picture coming out of Edmonton now. Alicia Asquith is filling in for Nancy Carlson tonight. And Alicia, one of the latest COVID fatalities in Alberta took place in your city, Edmonton there, and I suspect it's going to raise a few eyebrows.
Well, it's certainly bound to. For the most part these past few weeks, we've been hearing that it's been the elderly most at risk of dying from this virus. But Dr. Dina Hinshaw today revealing a young woman in her mid-20s died here. Now, it's unclear at this point if she may have had any underlying health issues, but regardless, it's certainly a concerning development for health officials. During today's briefing, Hinshaw continued to stress the importance of physical distancing to prevent further infections. And along those lines, AHS has decided to now further limit hospital visitors.
It becomes ever more important that we are minimizing the chance that someone may unwittingly bring in a virus to a hospital. So there have been measures that have already been put in place, such as restricting children from visiting and making sure that visitors have a screening check when they come in the door of a hospital. But really, the fewer people who come into any given place, the more the chances are reduced that of the virus could be brought in.
And Alicia, the Premier also announced the creation of a new program designed to highlight the ingenuity and generosity of Albertans during this pandemic. What can you tell us about that?
It's called the Bits and Pieces program. Jason Kenney says it's meant to highlight what all of us can be doing to fight the virus by coordinating innovative production and procurement efforts from across Alberta. The government says it's received more than 1,100 offers of support from private and nonprofit organizations. Those offers include things like providing mobile trailers for testing and treatment in rural areas, food and water services, hotel rooms, and manufacturing PPEs.
If you are a manufacturer, if you produce goods that could be in any way useful to this fight against the pandemic, we ask you to come forward, offer your help, and show us the kind of Alberta spirit in innovation, in production, that we can generate to help fight the pandemic.
And just a note from today's newser, the government says it now has enough data to predict how the virus will likely affect our province in the coming months. They say they plan to release that model early next week.
A lot of people waiting for that for sure. Alicia Asquith in Edmonton. Thanks, Alicia. Meanwhile, in the middle of this pandemic, a protest outside the constituency office of Alberta's health minister. Those doctors and others who gathered at the legislature, they were loud and they were furious over the UCP government's recent health care funding changes. Physicians have been pleading with the Premier to hold off on those changes.
Like those to be put on hold or upheld or appealed until the COVID pandemic is over. And then we're happy to return to the negotiation table. I don't know a single doctor who's not willing to take a pay cut to help Alberta thrive and become the strong economy and the strong province it once was. But what's happening right now is not that. What's happening right now is it's an attempt to completely take out our public health care system.
A women's shelter in Edmonton is in dire need during this pandemic. Wynn House receives 25% of its budget from fundraisers, which obviously have been canceled because of the crisis. And while it is operating at full capacity now, staff worry that won't continue without further financial support from the public.
Worst case scenario, we would have to limit again the number of people, perhaps not fill all our beds, perhaps not help as many outreach families that we otherwise would.
To a really troubling story out of southern Alberta now. Police in Lethbridge charging a 27-year-old man with assault after they say he intentionally coughed directly in an officer's face, telling him he'd hoped he'd get infected. Police say the man admitted to possible COVID-19 exposure. He'd been around someone who had been quarantined. Police had been responding to a report of domestic assaults. Well, Regina-based Merchant Law Group has filed a national class action lawsuit against 10 insurance companies. The lawsuit claims insurers are wrongfully refusing to honor their contracts with businesses experiencing losses due to COVID-19. One Regina restaurant owner says he's lost out on more than $100,000 worth of revenue since they closed up shop 3 weeks ago.
To our dismay and to our disappointment, we found out when we contacted them that unfortunately they have thousands of calls about it, but the interruption insurance doesn't fall in this category. And we're just wondering if there is an interruption, this would be the interruption insurance.
Siarkis says he is pursuing class action for the good of the restaurant industry at large. Merchant Law Group says it hopes more businesses being refused insurance payouts will come forward and join that class action. The City of Calgary is taking even more stringent steps to try to stop the spread of COVID-19. Events like the Mother's Day Run and Walk and the Lilac Festival are now cancelled. In fact, all public events are no longer happening at least until July 1st. And all plus 15 walkways will also be shut down during that time. So again, all public events cancelled until the end of June. And what kicks off right after that? Well, the Calgary Stampede, of course. Still no official word on whether that will also be cancelled. The City of Calgary is trying to make physical distancing a bit more fun. If you're between the ages of 4 and 12 and have a birthday coming up, a Calgary fire truck could soon be coming to your home to wish you a happy birthday. Requests can be made on the city's website. By the way, this is also happening for seniors. It's being offered to those seniors who are young at heart. Calgary Barbershop is doing its part to help during this COVID crisis. A trio of safety-conscious staff handing out 500 bottles of hand sanitizer today. Each vehicle is only allowed 1 bottle, but no one seemed to complain. The barbershop has been shut down for about 3 weeks now because of the pandemic, but staff plan to keep this going in the meantime.
Last week we were out here as well. We're doing this every single Friday for as long as the pandemic is happening. This is our community. Like we've been here for 7 years now. People in this community we're like family, right? They come in the shop, we hang out, we talk, we gossip, you know, so we become like a big community, big family. And I'm just trying my best just to help out where I can.
Nice to see. The acts of kindness in our communities continues to rise. The Bacon family of Calgary has one of those popular little free libraries outside their home where you can take a book and then leave a book. But when they started hearing about people having trouble getting food, they switched the setup to a little free pantry. A sign making a simple request: take what you need, leave what you can. The Bacon family says their neighbors have already stepped up to help.
We like to watch and see if someone is grabbing some snacks, or even better, when they're adding something to it.
Yeah, we added like a few things, like some cereal and stuff, and then people like a couple days later, there's like beans and canned stuff and like anything pretty much.
An 85-year-old Edmonton man got the surprise of his life earlier this week. Jim Hamilton is battling Parkinson's disease and dementia and is locked down at his home practicing physical distancing with his wife, Anne. So last weekend, his daughter, Lynn, turned to Twitter for help. She asked people to send drawings, photos, or anything at all interesting to her dad by mail or through tweets. Well, Hamilton ended up getting quite a few messages and a shout out from a member of the Edmonton Oilers, along with, yes, that signed number 93 jersey.
I'm going to sign a jersey and send it off to you as well. So, just want to drop in. Hope you're doing okay. Take care of yourself and your family during these crazy times.
Nice work. Okay, just a programming note before we go. If you're watching on the main CBC network, you're going to find your full Supper Hour newscast on this channel starting on Monday. So the Saskatchewan, Edmonton, and Calgary shows all returning to 30 minutes, which means, Carol McNeil, this is the last time we're going to be doing this. So I want to take the time to thank you and your team for being so accommodating these past few weeks.